Hello friends, welcome to Surya Ayurveda's Facebook platform from where I'm again trying to share some tips, some advice from Ayurvedic perspective, and today's topic is the cough, which can happen to any one of us, whether the wet cough or dry, adult, or even with the kids. So, whenever there will be a change of season, many of us will start having this issue of wet cough, dry cough, and if we have children, we can see that how often they suffer from this problem, and then we have to visit our general practitioner and seek their advice for our children as well as for ourselves, and most of the time the advice will be to start taking antibiotics, and antibiotic course will be given for 6-7 days, even for the children. That all keep happening, and when parents see that their child is continuously having that issue and have to take antibiotics again and again, and for them also sometime the 2-3 times when they have taken antibiotics, then if the problem is not getting better, they start getting a concern. But when that concern is shared with the doctor and practitioner, they will say now you should be going on inhalers. So when that sort of situation come up, one wonder that why I am having this cough all the time, and especially when the change of season comes up. Now Ayurvedic perspective and understanding on each disease is so simple and so clear that it helps us to understand that why simple hay fever, cough, cold, or serious autoimmune disorders, why they come to us, why we have to suffer. And again, Ayurveda in a very clear, simple, but very firm way convey us the message that all our problems relate with our lifestyle, relate with our diet, environmental factor, mental factor. And coming back to the cough, same principle is there. Now we know when we're talking about cough, I'm relating with my lungs, my windpipe, mouth part, nose, all that are the various organs associated with the cough. And now we all understand, those who have a bit of understanding on Ayurveda, that there are 3 bodily intelligence, which we call them as doshas in Sanskrit language. Vata, Pitta, Kapha. They are the one who are responsible for maintaining, supporting, guiding, and protecting our each bodily system, and including our respiratory system, which is known as pranavahashrota in Ayurvedic Sanskrit language, that will get affected. And on a normal circumstances, this whole, our lungs and windpipe, they all have a mucus, which is what we call as protective layer, which will help to let the prana get flow without any interruption. But when due to various factors, that lubrication, that moistness start becoming a bit more, problem can come up in the form of wet cough, because then inhalation and exhalation will start getting affected, and inhalation and exhalation is related with but prana, Vata and Udana Vata. I'm not going to get into too much of details of that, but trying to give you that as long as anyone, simple person or a practitioner who is trying to help people out, understand the qualities of what is causing the problem and help and guide those clients who come to them seeking advice and how to protect this continuous attack of this cough problem. They can guide them in a better way. In the same way, when they will be advising different kind of Ayurvedic products in the form of herbs, and they need to relate them in regard to the qualities of the herbs part there. So that is what we all need to understand, that how these things are happening. So first of all, understand that what are the food items which can hamper this smooth pathway of the prana in my respiratory system. All these qualities in that area of cold, damp, moist, when they start increasing through my food habit. And what kind of food habit? When I'm constantly eating bread, cheese, too much of butter, almond butter, then your smoothies in the morning. Many of us have an organic fruit punch or fruit juices in the morning. And then many of us who will make their breakfast with the muesli, yogurt, banana, some frozen fruit, blueberries. Kids will have wheat bix, cornflakes, or other kind of cereal with cold milk and a bit of yogurt and banana. So all these items, what they are? They are moist, they are heavy, they are sticky, they are damp. Now, in Ayurveda we understand one principle, like increase like. So this will make the mucus, which is naturally cold, clear, damp, moist, will start increasing further, which is dominated by the kapha intelligence. So when that built-up is happening and it starts manifesting in those cavities and then the lungs part, what will happen? Normal process of inhalation and exhalations will get affected, and client will have a more bout of a cough, forceful expulsion of the air, forceful exhalation process, which will end up in the form of a cough. Now when that is happening, you all can understand very simply that no matter how many times I go to my GP and get antibiotics, now what is the role of antibiotic is, they have to attack the whatever the foreign substance in the body is going now too much in the form of hair. We are talking about the mucus, right? And then even though that mucus has not yet got infected, it is still in a foreign material. From the Ayurvedic perspective, we call it as kapha ama. And when now that is there, they will prescribe you, and the role of antibiotic is to dry them up. That is where the biggest point all of you need to understand. When antibiotics are drying and trying to even kill the bacteria, if it has gone to that level, what is going to happen? That whole mucus, which is impacting currently my breathing, will start drying in the alveoli and the bronchioles. And then client will start feeling very good within 4 or 5 days. Child will also start feeling good. But then if they are keep eating those substances which I just shared and keep going out in the cold environment and then having a swim in the winter also in the cold water, what will happen? I hope you all can understand now. And then having ice cream in the malls when they go, not covering their head and feet and all in the wet, out playing or walking or other thing will impact your pranavashrota respiratory system. So that will give you continuously wet cough until you have let that mucus get out of your system. The bout of cough will keep coming and it will make you feel tired, fatigued, irritable. Sleep issues will start getting affected. You don't feel like eating. Now you are not interested in antibiotics more, and that's where you start looking at the other option. Your options are straight away you want to go to a natural so-called practitioner route, or you want to go to health shops to pick up some natural supplement for the cough. And what you get, different kind of supplement, echinacea or Manuka honey or those kind of different other products, mix of 2 or 3 substances, and try to use it. Sometime again you might feel a little bit better, but then problem keep coming because they have not mitigated fully your core cause of the problem. And the core cause is related with each individual separately, because you have selected different food item, you are eating differently, and until that aspect has not been taken care of, your problems will keep building. And because you have taken so much of these antibiotics and other, they have impacted your immune system, and it means they have impacted your lungs and the windpipe and all that different part of the channel. They got impacted and they're not able to perform their normal job effectively. Hence the problem keep coming up, where neither the supplement will work, neither will antibiotics are going to eradicate. So this is where the wet cough comes up. In the same way, dry cough is the one. Now, if on a healthy time I am eating such kind of food which are totally against and opposite to that lubrication or the kapha component, which is more dry, rough, cold, irritating substances, more and more processed substances like your chips, crisp, different kind of chips you are having, carbonated drinks you are having, coffee you are having, all these things, what they are going to, and then big bowl of organic salad you are having all the time. What they are going to do, they are going to create that dryness in your windpipe, dryness in your alveoli and bronchioles, and slowly when certain external factors comes up of the environmental change or cold and dry wind is blowing around you and you are in that sort of environment, or you are in a smoky environment, or wherever you are, those will immediately make you to get your windpipe constricted, and then again inhalation and exhalation process get affected, and you will start coughing, but that cough will be very dry, and that will lead to the more and more Vata complication, because Vata intelligence is the one which is going to deal with that problem or lead to that problem. Now, if I have this problem, or say my child has the problem, what is the solution from Ayurvedic perspective? Very simple solution. Everyone can follow that, follow some regimes also. Even if you will say, no, I'm not interested to follow regime, can you tell me some kind of specific remedies which I can give to myself, as well as if my child is suffering, what kind of remedies you can advise. So now, based on that, in Ayurveda we have very specific Ayurvedic herbs which you can use. Now those herbs can be used in the powder form, but first of all let me make you understand that what are the herbs which are good for these kind of condition, because this is now you can see this is a Vata and Kapha's intelligence getting affected. Down the track it might impact the pitta intelligence, where the inflammatory indicator or infection start coming up. But initially you will find these two doshas are the one which is leading to the problem. So there are specific herbs. One herb is known as Adhatoda. In Sanskrit we call it as Vasa, right? That is very specific Ayurvedic herb which help to correct the core cause, because it is balancing your kapha and pitta dosha. It is a bronchodilator. It is helping to expel the mucus. It is also act as an antioxidant. This way means help to stabilize your immune system. Then we have another Ayurvedic herb, very, very specific, known as Tulsi, known as holy basil in our English terminology. Again, very precise. It has a versatile impact on the different bodily system, but in the lungs areas it also acts as to expel the ama which is building up due to the vata and kapha. Then we have another herb known as licorice, yashti in Ayurvedic terminology, also very specific to expel the mucus and balancing vata pitta. Then we have very specific long pepper and black pepper. And then there is another very specific our Ayurvedic herb which is best for this condition, known as our Kushman. That is where even in asthma condition, which we will talk later on, these herbs play in a huge role, but they will only play their role when they are combined together. As I mentioned at different platform many times, Ayurvedic herbs never work as potent when you are giving them single herb. Ayurvedic herb will always work with the synergy of the herbs. Hence, you have to combine 3 or 4 herbs together. But then the second component you all need to remember is, if the dosages are not used correctly and you are using small amount of those powder, they will do but not much action. Hence, I'm going to advise you one product which is again made in Australia under the TGS regulation and under GMP certified TGS certified company, and that product is very, very effective. The name of that product is Respiratory Clear. So now if you look at this product, which I'm going to show you on a window, you might say that you are advertising on that. I'm not advertising exclusively, but I'm trying to advise you that if you have cough, select the right kind of product rather than just ending up taking supplements or other kind of thing. This product, yes, it is formulated by myself, and it is a very, very effective product because I have used it for last 30 years in this part of the world and total in my practice, because this problem comes up and thousands of patients always suffer from these kind of things, and in every season 600-700 clients I have to see with this cough problem when they come old and young, and with the kids also. So this Respiratory Clear product has a very good effect. Now if you see what the herbs which I mentioned, the first herb which I am talking about is Adhatoda. If you will be able to look into that, or when you read on our website, this is used 1.8 gram in a one single dose. Then the second herb is Yashti, as I mentioned, your licorice. Again 1.5 gram has been used. And then comes the third one, which is the holy basil I mentioned, 1 gram is used. And then the other herb which I was talking to you, Pushkarmool, very precise for your lungs as well as for your heart, because whenever your respiratory system get affected, you will always have some impact on the heart. So that's where this herb is also very good. And again 1 gram of that is used. Again, these herbs dosages are according to our traditional Ayurvedic text, where they have given that below that this herb will not give you the desired result. Now on top of that, if you look at current researches which I have mentioned many times, that because Ayurvedic herbs are becoming point of interest to various Western herbalism part companies, and even the Western medical system is trying to do the research, because problem, that's in a second, not in a big issue for us to talk here, because now antibiotic resistance are happening in many diseases, and hence they are looking for that what kind of herbs can be used, but they're trying to use it from the Western perspective, where the other component need to be discussed. But then when they are doing some research, the efficacy about of these herbs, that how they work, because they will be always looking for the active constituent. They don't go with the Vata Pitta Kapha focus. But then in Ayurveda we always use these herbs in the same format, extract and the powder. We are using extract, which is 100 times potent than the simple herb, and then the dosages, as I mentioned, they are related with the extract dosages. So that product actually work for very effective whether you have a dry cough or wet cough, and help to mitigate this problem, and regular use of that. And alongside this you will be using another product which is known as Agni-tone. And the reason of Agni-tone is also a very traditional Ayurvedic formulation, but prepared here by me, by making the formulation potent based on what the dosages has been given in our traditional text. So that way both of these products will help to burn the ama, which is leading to these problems, and as well as restore the function of your lungs and sinus cavities and clear them up, and you can feel and breathe very effectively clear. Your sleep will be better. Now come to children. For kids, I'm talking about say 0 to 5 year or like that, then these capsules will be a bit difficult to give to them. Hence you have to look for some specific palpable liquid, which in Ayurveda we call as syrup, and those specific syrups are very effective. One of them is known as Coughnil, which is very specific for the bout of cough, and it has all these herbs but in the more liquid form, so we have to make the decoctions and then prepare them. There is a very precise way of making Ayurvedic syrup, and the honey is the base with them. Then there is another syrup for kids only, which is known as Sapnil. Sapnil is acting as an antibiotic, very effective, anti-infective, antiviral, so that also stabilize their immune system. And then there is another third preparation known as Live Life. So Live Life work like Agni-tone as a ama burning. So these three syrup can be given even to a 1 month old, 2 month old, 5 month old, 6 month old, even though in that early stages we don't need to give medicine to the little one, but we need to give the medicine to the mom. That's where that part comes up, when they are still breastfeeding. But if they are now 5 year or 3 or 4 year and they are on the solids and external food item, then these syrups help a lot. So if you are having frequently suffering from these problems, or your family member has suffered, then my advice to all of you will be that you must use Ayurvedic formulations which are more effective and helping us to correct the core cause behind that. And then in addition, if someone of you are keen to look at that, what are the regimes which I can do, the most important, most effective regime for the cough is every night without fail, no matter how busy you are, you should do the steam inhalation. And steam inhalation, not that you have taken the boiled water in a cup and then you put some eucalyptus drops. That's not going to work. You have to take minimum 2 liters water, put it on the floor, add 10 drops of eucalyptus oil, cover yourself with a blanket and do for 7 minutes, then go to bed. In the same way, in Ayurveda we have a very specific regime we call as Nasya. Nasya is a very specific medicated nasal drop which you can use, and always have to use warm, and that will help you to clear up your these channel. All the sinus cavities will start getting clear, because after this wet cough down the track, if you have taken antibiotic 3-4 times, you are now building up the foundation for migraine and sinusitis and those kind of serious problem. So that will be very good. And in the same way, either the dry cough or the wet, some people will always feel that something feel like stuck in my throat. That's where your gargle will play in a huge role. And gargle is a glass of warm water with 1 teaspoon Himalayan salt, or black salt is the best. 2 times or 3 times you can use it. So that's the way you can work these regime. Yes, your morning routine of brushing and scraping, if anyone following Ayurveda or practicing Ayurveda and not doing it or not advising, it means they are not into Ayurveda. Their mindset is totally in a different way. And that's what we should look at. That brushing and scraping is in a different level of regime, which help us in different ways to keep ourselves more stable. So that's the few things you can do. And obviously, yes, all the food items which I shared with you, you need to look at. If they are a part and parcel of my day-to-day life, I must eliminate them. Eliminate them for at least that time period of 4 weeks or 6 weeks, so that you can let your body to get more stable. That's what you need to look at. And in the same way, my advice, I know that my advice is not going to be taken by them in a right way, but as I mention all the time, my focus is in life how we can help together our community, our people who are suffering from such problem under the influence of ignorance, and how we can guide them that they can play a role in mitigating these problems with their own effort and using the right kind of product. So my advice to different kind of practitioner, if you are also in practice and you are also advising some products to your client, you should also look at what these herbs are as compared to whatever you might be advising, and see the outcome. Don't trust me, trust on your client and trust and see the outcome and the result. In the same way, diet-wise, if you can elaborate your advice based on Ayurvedic principle and mitigate all that part, rather than just telling them to avoid nightshade and avoid all the dairy products and like that, there are more wider advice should be given. So all together we can establish a good network of wellness practitioners who can help people from these problems, which ultimately become the foundation of many serious problems, which I mentioned. Asthma is there, pneumonia is there, then you can have an pleurisy issues, and all that part can make the things worse for your client. So that's all from my side. Thanks everyone.